So I've been requested to respond on Bernie Sanders, who is like the American version of Jeremy Corbyn. Let's get down to his argument.
So tell me what it means to be a socialist.
A democratic socialist. What it means is that one takes a hard look at countries around the world who have success records in fighting and implementing programs for the middle class and working families.
The only ism with a middle class is capitalism. If you destroy capitalism, you're destroying the middle class. It's that simple.
And when you do that, you automatically go to countries like Denmark, Finland, Norway, Sweden, other countries which have had labor governments or social democratic governments. And what you find is that in virtually all of those countries, healthcare is a right of all people.
So these Scandinavian countries are grossly misunderstood. They're social market economies which comprise of strong economic business freedom, free market principles. I wouldn't go as far as to say that they're free markets, but of course they are mixed economies. They do have the higher tax rates, and of course you could look at Norway. The higher tax rates is crippling their domestic economy as the cost of living is through the roof.
Tack. Across Scandinavia, the average price of everything from a knitted roll neck to pastries from the local bakery are some of the highest in the world.
In other words, where they got the high GDP from was off the back of the energy sector being the fifth largest oil exporter in Western Europe. And looking at GDP is something black and white. Kongsberg Automotive, as I've pointed out numerous times before, only has 5% of their workforce left in Norway, and that's because they can't afford to produce in their own home country.
They're united by their Viking heritage, but also their shared reputation as one of the most expensive regions to live and visit. Whether it's buying a car or a TV, consumers in Scandinavia pay some of the highest prices in the world. Even buying groceries is costly, with all three countries' food and drink prices above the European average.
So they're actually getting the likes of the United States, Mexico and China to produce for them. They're not these utopias he's trying to make out to be, and they're not as socialist as he's trying to claim. Yes, they're strongly capitalist to some extent, but the socialism with that of the higher tax rates, etc., is actually harming their economy. It's restricting them in many regards. Now, I've pointed this out before. Just have a listen to what this guy says.
Where does the healthcare technologies come from that the Swedish hospitals use? Where do the drugs and the medicines come from? Well, all of it is really invented, implemented in the American competitive healthcare system. So in effect, what we're doing is that we're free riding on the entrepreneurship that goes on the competition that goes on in the American healthcare system.
Moving the social security and the welfare over into the private sector and whatnot, and especially today with pensions and whatever. They were progressively moving away from socialism, especially what harmed their economy in the 1970s and 80s, etc. So these Scandinavian countries contradict them, in other words.
And their systems are far more cost effective than ours. College education is virtually free in all of those countries. People retire with better benefits. Wages that people receive are often higher. Distribution of wealth and income is much fairer.
Again, what he's not telling you with the wealth redistribution, etc., is the fact that they tax the bottom and middle income earners just as much as they tax the rich.
Let's say I want to buy a sweater in Denmark. I pay 300 kroner for it, but how much of that money actually goes to the vendor? Well, first there's the 25% VAT, leaving the seller with 240 kroner. The clothes shop also has to pay a minimum 22% of corporate income tax. That means that a big portion of the money I paid for my sweater goes to the Danish government. Not to mention there's a hefty payroll tax on employees' wages, and the store still has to pay for rent, electricity and cleaning, all of which are taxed too. These taxes mean that for Scandinavian businesses to make a profit, they need to charge their consumers high prices. For some companies, this has proved too much of a burden for their business model.
So in other words, it's not just a case of just taxing the rich, and you hear it all the time for these socialists. You even seen it in a recent address of that of Alexandria Ocasio-Cortez. The reality is these Scandinavian countries tax the bottom and middle income earners just as much. Sweden's got a real unemployment rate 3 times higher than the official figures. They've actually got a high unemployment rate, and that's because of the fact that they can't afford to produce in their own home country. The higher tax rates is crippling them. Many businesses can't afford to take them on, and therefore it contradicts the narrative about how they're paying out these massive wages, etc. But how's that affected the employment, productivity in the economy? Well, it's harmed them. So in other words, they're not going to sustain that in the long term.
Their public education systems are generally stronger than ours. And by and large, their governments tend to represent the needs of their middle class and working families rather than billionaires and campaign contributors. So when I talk about being a democratic socialist, those are the countries that I am looking at, and those are the ideas that I think we can learn a lot from.
Again, he's contradicted because of the low levels of government regulation. That's why they're benefiting the middle class to that extent, because the only ism with a middle class is capitalism.
When you take something like healthcare, now, healthcare to my mind is a right of all people.
So again, with regards to healthcare, what gives them the right over healthcare? They try to claim that they've got a right. It's like someone saying, well, I have a right to a job. Well, if that's the case, then you're taking away the rights of the employer to agree to disagree. If the employer disagrees, the employer cannot sack you because you've claimed a right over a job. That's unequal rights because you're claiming to have a so-called right and you've taken away the rights of others, such as the employer. Well, it's no different with regards to the relationship of someone claiming they have a right for healthcare and that of the doctors and nurses. Now, those doctors and nurses are not your slaves, but the reality is, how do you pay for the healthcare system? Because that's the only way you can pay for universal healthcare is through forcing other people to pay for it. Otherwise, you wouldn't have a universal healthcare system. So how the hell can you claim the labour and that of the earnings of those individuals that you have a right over those things? You've got no right over those things because you're not entitled to the earnings of another individual. Healthcare is a good, no different to anything else in the market.
That's what I believe. I think every man, woman and child is entitled to healthcare.
Just because you claim to have a right over healthcare doesn't mean you can just wish away the economic reality of scarcity, and that's a very big reason why thousands of people have been left in neglect every single year on record in the NHS, contradicting the narrative that it's available for everyone. Yeah, I would love to see them say that with the massive big long waiting lines.
And that right exists in virtually every other major industrialized country on earth. We are the odd guys out there. Despite the modest gains of the Affordable Care Act, we have 35 million people who still have no health insurance, and more importantly, millions more are underinsured with high copayments and high deductibles.
So he's talking about the insurance, but he doesn't touch upon the direct primary care system that got rid of 80% of their health insurance. The reason why they got rid of 80% of it is because it's completely unnecessary.
And the idea, again, that just insurance isn't bad, but it wasn't helping. It's a tool, and we want to make sure that we use that tool correctly. You don't have car insurance for gasoline, life insurance for groceries. So why fundamentally are we using health insurance for outpatient care, family medicine, internal medicine?
Health insurance is useful for the specific type of jobs, for things that are more serious. And because the fact that they've required health insurance for absolutely bloody well everything in the main American healthcare market, that's part of the reason for why the healthcare costs have soared out of control. You know, by simplifying the model and getting health insurance for the right type of jobs, direct primary care model was able to dramatically reduce the costs. It was part of the reason why.
And I think that is not an area where private insurance companies should be functioning, because once you have private insurance companies there, their goal is to make as much money as possible, not to provide quality care.
It's just like the same argument with regards to the private pharmaceutical companies. They got away with a collusion, driving the price up and shafting the consumer because of the absence of free market competition. In other words, the government's intervention created the problem. It's no different to the insurance problem today. And if you've got a demand that far exceeds that of the supply available, then of course the costs drive up. What the bloody hell do you expect in the absence of free markets? When you've got the absence of free market competition, you've got that bloody well problem because government created that.
So in terms of healthcare, yeah, we should have a public healthcare system guaranteeing healthcare to all people in a cost-effective way. I think a Medicare for all single-pay approach is the way to do it.
And he calls it cost-effective, which is just ludicrous to say the least. In other words, they sit and complain about the rip-off costs of living in Great Britain, and they complain about all the cutbacks elsewhere in the economy, but they don't realise that that's where the money comes from to pay for all their so-called free services. In other words, their free services were never more affordable.
In terms of education, I don't know how you have the United States being competitive in a global economy if we do not have the best educated workforce in the world. What does that mean? It means that everybody should be able to get all of the education they need regardless of the income of their families.
First of all, he's talking nonsense. They pushed the cost of education through the roof through the state intervention by subsidies, etc., that ended up driving costs through the roof. But he ignores the laws of supply and demand, where they look at the supply of placements available and they think they can just ignore that. If demand far exceeds the supply of placements, of course the cost is going to drive through the roof. But the real narrative here is why he wants complete state education, so-called free for everybody. It's not because of the fact that he cares about you. It's because of the fact that once the government owns the education system completely, then the government owns the narrative over the information that feeds you. In other words, it owns a monopoly over the type of information that feeds you. It wants you so that when you leave school, you become subservient to the state. Now, they've already practically got that anyway. The old Illuder Satan's law and the whole thing to do with the Prussian school model, because that's where the American state education system stems from. Even here in Scotland, with the education system we've got, the education under this so-called free education is diabolical, and it's getting worse by the year. A lot of folk in this country are starting to waking up. It's because of the state education system that's been brainwashing them with all this nonsense that you need free this and free that and free this, that and the next thing. They end up coming out the end of the education system and they end up supporting all these things, and they've been recently seeing how authoritarian the government's been becoming. You never give the government the power over education because it's no interest of actually educating people. All it wants to do is create a population that's subservient to it.
What does that mean? It means that we should go back to where we were 50 years ago and what other countries around the world are doing, Germany, many other countries, and say, you want to go to college? You have the ability to go to college, you have the desire to go to college. Public colleges and universities will be tuition free.
But who the hell does he think pays for that? Does he think that the tuitions are just free and that's it? It comes directly for the private sector taxpayer. And how in the name of his democratic socialism is he going to pay for that when he cripples the backside of the private sector? He just talks pish.
Because education must be a right of all people. So it seems to me that when you look at basic necessities of life, education, healthcare, nutrition, there must be a guarantee that people receive what they need in order to live a dignified life.
Again, folk, nobody has a right to education. How else do you think you pay for all that stuff? You have to force other people into paying for it. So how the hell can you then claim a right over it? You don't have the right over other people's money.
Implicit in what you just said, and knowing some of your sort of policies around this, you want to see the government bargain down healthcare prices quite a bit lower than they are now. Americans pay much higher prices.
Let me interrupt you. The answer is absolutely yes.
Yeah. So I have a slightly different question off of that, though. The argument people make about that is that a tremendous amount of healthcare innovation around the world are other countries freeloading on the amount of money Americans pay to induce innovation in the pharmaceutical sector and the medical device sector. Do you worry that if we got to that point, we would actually see a slowdown in healthcare innovation?
I don't. A lot of the money in healthcare research goes into Me Too drugs, copycat drugs, where they will come up with another drug that really doesn't substantially increase the kinds of benefits that it has on the patient.
So get this, folk, in terms of what Milton Friedman pointed out in 1979, he goes on to state, the number of new chemical entities introduced each year has fallen by more than 50% since 1962. Equally important, it now takes much longer for a new drug to be approved, and partly as a result, the cost of developing a new drug has been multiplied manyfold. According to one estimate of the 1950s and early 1960s, it then cost about $500,000 and took about 25 months to develop a new drug and bring it to the market. By 1978, it was costing $54 million and about 8 years of effort to bring a drug to the market. 100-fold increase in cost and quadrupling of time compared with a doubling of prices in general. As a result, drug companies can no longer afford to develop new drugs in the United States for patients with rare diseases. Increasingly, they must rely on drugs with high volume sales. The United States, long a leader of development of new drugs, is rapidly taking a backseat. We cannot even benefit fully from developments abroad because the FDA typically does not accept evidence from abroad as proof of effectiveness. As you can see there, because of all the government regulation, it creates a problem as per usual. The absence of the free market, and since it costs so much and there's such a long period of time just in order to get a new drug to the market, disincentivizes the market as a whole. How the hell do you expect the market to be so innovative in terms of drugs, etc.? And again, that's the fault of government. That's not the fault of the market.
In my view, This issue of high prescription drugs, the high cost of prescription drugs, is a huge issue. It's an economic issue. It is a moral issue.
So folk, if it's a moral issue, why the hell intervene with the government and create a problem when it takes so long for drugs to get to the market? And if it was a moral issue, why the hell through the FDA are they restricting certain drugs that could potentially save thousands of people's lives?
And I very much reject what goes on in this country right now. Right now in America, uniquely among major countries, drug companies can double the prices for a drug tomorrow for no particular reason, just because they can make more money. We have seen that with name brand drugs. Now we're seeing it increasingly with generic drugs. So I think absolutely that the cost of prescription drugs should be regulated.
So government has actually created a problem, and as I've pointed out before, the third-party payer system through government actually created the very problem with the collusion between the private pharmaceutical companies getting away with driving prices up and shafting the consumer. And despite the fact that the actual government regulation created the problem with the drugs and drove the prices through the roof, he wants more government regulation.
That speaks to the power of the pharmaceutical industry. Pharmaceutical industry, pharma, enormously powerful lobbying forces, forcing us to pay very, very high prices in this country. I talk to physicians who work in working class communities, and they tell me 1/4 of the prescriptions they write are not filled. That is insane.
Again, he's playing the game of trying to blame the private sector. It was the government's third-party payer system. All the third-party payer system means, because of what government's created, it means that there's the absence of the free market, there's not the ability for the consumer to shop around for the cheaper cost. So in a free market, the consumer can shop around for the cheapest provider, and there's a straight transaction between the consumer and provider. Now, that's not how the main American healthcare market operates. It operates in a third-party payer system. Simply means someone else other than the consumer gets to hold a monopoly to determine the cost. That's why the collusion between the private pharmaceutical companies happened, because of the absence of free market competition. In other words, because of government. Basically, his argument goes on for quite a lengthy period of time in his interview, goes into a variety of other topic issues I can't even be bothered going into. His arguments are very much utopian, especially the idea that government's going to end up serving them through mere socialism in the economy. That's actually mere power in the hands of the state. I even had somebody earlier on, saying to me that the free market's utopian, that Hong Kong wasn't a free market because it had government ownership of housing. They don't understand that things are only black and white. It's like, everything has to be exactly this. It's my absolutism. If it doesn't fit exactly this, then apparently it's not a free market. They live away in cloud cuckoo land because they don't understand that everything is down to a question of scale. So yes, Hong Kong, Singapore, they were strong free markets. That's not to say that, of course, they had free market money and free market banking, etc. And that's where we should be moving towards, perhaps even arguably freer than that. So anyway, folk, I hope you've enjoyed the video. Thank you for watching. If you've got anything you would like to add in yourself, comment in the comment section below. Be sure to like the video, share the video, and I'll be sure to get back to you. Thank you for watching. Cheers.